My name is Mala Samuel, and I'm one of the millions of people affected with sickle cell anemia worldwide each year. Today, I'm going to talk about sickle cell anemia. Sickle cell anemia is an inherited blood disorder characterized primarily by chronic anemia and periodic episodes of pain. In sickle cell anemia, the hemoglobin is defective. After hemoglobin molecules give up their oxygen, some may cluster together and form long rod-like structures. These structures cause red blood cells to become stiff and assume a sickle shape, which blocks small blood vessels and cause pain. The presence of two defective genes, SS, is needed for sickle cell anemia. If each parent carries one sickle hemoglobin gene, S, and one normal gene, A, each child has a 25% chance of inheriting two defective genes and having sickle cell, a 25% chance of inheriting two normal genes and not having the disease, and a 50% chance of being unaffected. Sickle cell affects millions of people worldwide each year. Although 60 to 80% of those affected by it are African American, people from Saudi Arabia, India, and Spanish-speaking regions like South America, Cuba, and Central America, and Mediterranean countries such as Turkey, Greece, and Italy are also affected. Many people view sickle cell as a black man's disease, but this disease does not discriminate. It has many different faces. That is especially true since there are more and more interracial marriages and births. This little-known disease occurs in about 1 in 500 African American births and 1 in every 1,000 to 1,400 Hispanic American births. Approximately 1,000 babies are born with it each year. Sickle cell disease is characterized by symptoms such as hand and foot syndrome, which occurs in kids, fatigue, paleness, joint and organ pain, eye problems, jaundice, which is the yellowing of the skin or eyes, and delayed growth and puberty in kids, and often a slight build in adults. 20 years ago, sickle cell was a death sentence as kids rarely live to become adults, but thanks to new therapies and treatments, people can live well into their 50s and even older. Some of these treatments include blood transfusions or exchanges, oral antibiotics, hydroxyurea, and acupuncture in some cases. Some sickle cell patients require as many as 15 hospital visits per year. Because of these frequent visits and the amount of medication required to control pain, sickle cell patients are often viewed as drug addicts. Some hospitals even go as far as refusing them pain meds. Because sicklers usually have so many hospital visits, veins can collapse or become inaccessible because of scar tissue. When this happens, devices such as photocatheters or PICC lines are placed under the skin to provide medication through them intravenously. 1 in 12 African Americans carry the sickle cell trait. With all the complications that arise with sickle cell, it is important to know your sickle status. Knowing your sickle status decreases the chances of falling sick because of overexertion or dehydration, and having a child with someone who also has the trait. Getting tested can open up a host of avenues such as disease and crisis counseling to you and your family. Having your baby affected with sickle cell because you didn't know your status is ignorance, which is a disease in itself. If we all take the precautions necessary by keeping hydrated, avoiding drastic changes in body temperature and altitudes, staying stress-free, and getting tested, no matter what race, together we can stay sickle strong.